The opioid epidemic sweeping the nation has found its way affecting the Harrisburg region for the past several years. Communities around the area have been overloaded with amounts of these highly addictive drugs to fulfill an entire city. As someone who has seen one of his high school peers lose his life to an opioid overdose, the approach to combating this issue needs to be improvised.
According to David Wenner of PennLive, Dauphin County is the region's highest rate with 31.3 deaths per 100,000 residents. Additionally, neighboring rural areas like Adams County has seen its overdose rate increase by nearly 300% in 2017. Many people blame the high opioid abuse rates on the large pharmaceutical companies pushing their pain medications to doctors and hospitals in order to make a profit. Recently, Dauphin County Commissioner Jeff Hayes and his colleagues have filed a lawsuit against 11 drug manufacturers and 3 doctors they say ignored the addictive and debilitating effects of opioids and aggressively marketed the painkillers to make a profit.
To understand more on the opioid epidemic and its scale, watch this PennLive news clip.
Think about this. By the time you go to bed tonight, 13 of your fellow Pennsylvanians will have died from an overdose of prescription opioids or heroin. 13 people. That's the starting lineup of your kids' soccer team plus 2 substitutions. That's an entire Sunday school class. If current trends continue, and there's every reason to believe they will, more than 4,600 of your friends, neighbors, and loved ones will die by year's end. That's a good-sized Pennsylvania borough. Despite the good faith efforts of policymakers, lawmakers, public health experts, law enforcement, and educators, even our clergy, the death toll has continued to rise. As an editorial board, we've spoken out on this issue for years, urging lawmakers and policymakers to act aggressively to confront this public health threat. We've told the stories of those on the front lines trying to break the cycle of abuse and to save lives. But it hasn't been enough. So today, with a rare front page editorial, we're stepping up and raising our voices in the face of this unprecedented public health threat. We'll be calling for the passage of legislation, for increased training and education for all those touched by this epidemic, and for tax credits for employers who offer life-saving services to their employees. Most importantly, we want President Donald Trump to recognize this threat for what it is and to declare a national emergency in response. We'll do our part too, by telling the stories of those fighting this threat, by convening forums and public events to search for solutions, and by reaching out to our readers to ask them to lend their expertise and passion to this cause. If there's any reason to doubt the urgency of what we're up against, consider the numbers alone. Nationwide, 1 in 3 Americans, or 98 million people, used prescription opioids in 2015. The economic cost is also staggering. In 2016, prescription opioid overdoses, abuse, and dependence cost the nation more than $78 billion. Those hardest hit by this epidemic are not strangers. They're your friends, they're your neighbors, and they're your children. They're Casey Schwartzmeyer, a 20-year-old from Allegheny County, whom her mother described in a heartbreakingly candid obituary as funny and full of life, and she was a drug addict. They're Terry Wayne Mathias, a 39-year-old father of 2 from Greensburg in Westmoreland County. His was one of 86 deaths in Westmoreland County to be caused by an overdose of fentanyl, a deadly synthetic opioid. Like the great fights that have come before, this is one that calls on Americans to summon the best things in themselves to get the job done. Their strength, their tenacity, their will, their grit, and most importantly, their compassion. In this fight, we cannot shirk from our duty. Please join us.
There are corrupt doctors and pharmaceutical companies all over central Pennsylvania taking advantage of hundreds of families. However, Penn State Hershey Medical Center, having the long history with providing quality health services to families all around the Commonwealth, has the potential to greatly improve the opioid situation how it stands today. Recently, Scott Gilbert from Penn State Health reported an initiative at the Pennsylvania Psychiatric Institute funded by a $1 million grant creating a new system aimed at revolutionizing the way the disease is managed by recognizing medication-assisted treatment as the gold standard of care and providing a way to fast-track people with the disorder into treatment. Although this system is extremely beneficial to providing those seeking for help with a place to get the proper treatment, there needs to be a system catering to those who are out of reach and without motivation to find rehab themselves. Researchers from the Johns Hopkins Bloomberg School of Public Health analyzed data from 6,000 people who reported on the National Survey of Drug Use and Health that they were either dependent on opioids or that the drug's use was causing problems in their lives. The study found that the most common treatments for opioid addiction are self-help groups and outpatient methadone clinics. The authors also found that many places lack sufficient drug treatment programs and only 22% of addicts received any kind of treatment in the 2009 to 2013 survey period. An on-the-go mobile treatment service, including an ambulance, medical staff, and clean equipment, would be ideal for targeting this isolated group of people. This service, along with a system of coordinated events held at local points of interest like parks and recreation centers, will allow people suffering from opioid addictions to walk in and find help rather than having to schedule an appointment for months down the road. These localized events will serve as a sanctioned injection site where people with long-time addictions will be subject to a clean environment for taking their proper dosage, as well as medical consultations so that they can start their journey towards a healthier lifestyle.
Also, the on-the-go service would not be costly to the amounts already being made by Penn State. Hershey Med is already equipped with many ambulances and pain treatment staff members. Clean equipment, including needles, emergency med kits, and sanitary products, are generally inexpensive. Methadone treatment and support services run for around $126 per week.
Penn State will not only benefit from the increase in clientele after each event, but will increase their overall image from the community. When people see that the opioid fatality rates are decreasing due to the efforts of Penn State Hershey Medical Center, institutions and medical centers all over the country will begin using this model. Additionally, residency and fellowship students will have the opportunity to gather some experience under their belt in an adaptive work environment.
If further action isn't taken to improve opioid fatality rates, Central Pennsylvania could possibly be seeing detrimental consequences during the next decade. As cited in the forecast by STAT, professors from 10 universities predicted that the death toll from the epidemic could top 650,000 over the next 10 years. What may take a profound effort to accomplish will be the cost of keeping families together and saving thousands of lives.